of COVID-19 in Escambia County. It's the latest update from the state, shows a 10% positive rate for July, which is the July 11th, which is the lowest test rate in 12 days. So it was good to see some of our numbers coming down, but we still remain significantly high. The number of COVID-19 hospitalizations was 175 yesterday for July 12th. For reference, there were 122 COVID-19 hospitalizations 1 week ago and 22 hospitalizations 1 month ago. We did on, I believe on Saturday, we had our first day where the numbers had trended downward, but we had a significant spike, an increase yesterday. We went from 140s to the 175s, or 150 to 175. So again, we've seen continue to see an increase happening there. This is a reminder that the face covering requirement remains in effect in the city of Pensacola. The ordinance requires face coverings to be worn inside businesses within the city limits of Pensacola. Please continue to wear your mask if you're inside a business. The city is making 20,000 masks available to the public free of charge at several city community centers starting today. Locations and dates and times for mask distributions are as followed. Sanders Beach Corinne Jones Resource Center will be Monday through Friday at 10 a.m. to noon, 10 o'clock to noon. So in the morning, Sanders Beach. Cobb Resource Center, Monday through Friday from 1 to 3. So in the early afternoon, Cobb Resource Center from 1 to 3. And then at night, from Monday through Thursday, just Monday through Thursday from 4 to 6. So in the afternoon, the Gold Point Resource Center will be having them. Masks will be available on a first come, first served basis. Each household will receive one machine washable mask per person with a limit of 5 masks per family. Masks are not available to business owners to distribute to their employees. We are continuing to work with businesses as we move forward. I keep the main thing on trying to, as we try to combat COVID-19. The main things are thinking about continuing to do the things that we talked about that we were doing so well in April and May, which are washing our hands, social distance, and wearing masks. If we can do those three things, I'm confident the numbers we started out with, we can continue to trend down. Generally, everything has kind of a 2-week lag, so we'll start seeing the efforts of what we've done and hopefully being able to slow down some of the positivity, some of the numbers, and eventually some of the hospitalizations. Community centers. We have closed all of our community resource centers and programs until further notice due to an increase of COVID-19 cases in Escambia County and with city staff. Exceptions, the free mask distribution will continue. Senior meal and youth meal pickups will continue. Outdoor adventure camps will continue, and the city of Pensacola outdoor pools and parks will remain open to the public. Again, we have a special council meeting. The city council will hold a special council meeting on Tuesday, tomorrow at July 14th regarding the Confederate monument located at Lee Square, as well as the renaming of Lee Square. The meeting will begin at 5:30 with all public participation taking place remotely. The meeting will be live streamed at cityofpensacola.com/video. There are also several options to provide comments to participate in the meeting. If you wish to speak during the meeting, fill out a request to speak form at cityofpensacola.com/cc input. That's CC input. From link you will go live at noon on July 14th. The submissions will be accepted from noon until 5:15 on July 14th. So again, that link, the CC input, will go on at noon tomorrow. You can go on the city's website from noon to 5:15, and you can register, and you will be able to speak at the council meeting. You can also send an email to City Council, email Council Directive Don Crayer at DKRAHER@cityofpensacola.com to share with the City Council. Send comments to be read into the record at the meeting. You can also email Don Crayer at dcrayer@cityofpensacola.com with your comments and requests that they be read in the official record. The challenge will be, I believe, you only have 2 minutes, so whatever you type up, you need to make sure that Don can read that into the record within 2 minutes. So again, these are things that are that will be going on that will allow you access at that particular time. Resident satisfaction survey. We are kicking off our annual resident satisfaction survey today and encouraging all city residents to participate and let their voices be heard. City residents are asked to complete the online survey at UWF at EDU resident survey, or by phone at 850-495-2666 by Sunday, August 9th. The survey asks residents about their satisfaction with a variety of city services, facilities, including streetlights, sidewalks, neighborhood safety, and more. Also prompting participants to rank their top priorities for the city of Pensacola. The city's annual survey is being conducted by the University of West Florida Haas Center. All data obtained from participants will be kept confidential and will only be reported in the aggregate form by reporting only combined results and never reporting individual ones. Also, we are also beginning to start our employee survey here, which is we started last year and we are continuing. We would have hoped to have started earlier. Obviously, COVID has backed us up a little bit to June, but these again are things that we stay focused on, our process improvement, how we can continue to be better, and we look forward to getting things back from employees and seeing where we are, what we're doing, and how we can be better. We also do the same thing with you, the residents, and we look forward to hearing from you on that as well. With that, I'm open for what we've done. I'm open for questions and happy to answer any questions that we can.
All right, the first question is from Jeremy with InWeekly. Can you preview what staff will present to council tomorrow regarding the Confederate monument?
I guess, I mean, I'm not sure what staff is. The recommendation that will be coming from us will be much the one that we released last Tuesday. So again, we will present that, I'm sure, from there. I know at least a couple of council members have said they wanted to be on as sponsors on that. So I guess that will be taken care of. I think you know, it asks that they are looking to remove, but that they do so and allow the mayor's office the opportunity to coordinate where or what we end up doing with the monument. So I guess from that standpoint, if there are any specifics or what happened, but again, the council can do any number of things they want to do. A number of people have come up with me. There's been keep it up, leave it down, you know, do any number of different things with it. The council will really have the ability to do whatever they want to do. It's their decision, and they'll be able to do whatever they want to. So, you know, from that standpoint, we'll look to hear tomorrow from them, but I'm sure there'll be a lot of speakers. I know we've received significant amount of emails. So, you know, I think they will have a significant amount of time to listen to people's comments and go forward from there.
And this is from Andrew McKay. The agenda for tomorrow does not currently have a ballot initiative alternative. Do you plan to offer that? What is the procedure for that being an add-on?
Again, the council, that's the council's decision. The ordinance is very clear that the council does that. If the council wishes to go and create that, they're more than welcome to do that. I know a number of people have written on that or asked for those things. But again, I think at this particular time, the council will have to make that decision, as I've communicated to other people.
And this is from Jeremy. Thoughts on the initial citizen committee meeting last week?
You know, unfortunately, I had to leave. My wife had friends in town that we had to go meet and have dinner with. I got a chance to open it. As I said before, I placed the Pensacola Police Department and the men and women who work for it. They do some of the best jobs, and they're some of the best when you look at our policies, procedures, the things that we're doing already. I put them up against anybody in a 300-mile radius, yet we are continuing to lean forward. It's process improvement, much the same we do with our surveys. We look at what's going on. We look at how we can improve. I think our police force is always looking for ways to be better. That's why we hired Dr. Cedric Alexander, and he is doing that for us. So from this point, you know, I think that group From what I did hear from my conversations with Keith, I mean, they seemed interested in getting to work, and at least that's the good news. And I think they'll be interested to see how things go. I know Chief Leiter will be interested to work with them and show them what happens, what happens for police officers, what decisions they have to make, so that people understand what we do as police officers, and then how do we better do that and find a way to create a better working relationship with police officers in our neighborhoods and our community. I mean, I think this is all a goal about how we can be better. And I think the PPD is taking that, the city's taking that, and we're moving forward and seeing what we can do to be better.
And this is also from Jeremy. What do you think will end up happening to the monument?
I mean, it'll be voted on by the council, Jeremy. That's what I think will happen, and we'll do whatever we need to do and execute whatever comes down through that decision. I don't want to presuppose anything that the council will do. They have the right to do anything, including, as Andrew said, look at something totally different that's not there. They have the ability to do whatever they need to do.
And this is from Rebecca with Channel 3. There's a proposed ordinance on the agenda for City Council regarding the preservation of sensitive properties such as historical properties. Is this in light of the debate over the Confederate monument?
I think this is the one that we put in there dealing with mainly the DeLuna site properties, and I don't see Keith on here. I mean, I'm pretty sure that's what that was. We had already made some conversations about that, but we also have not just, and Keith's nodding his head, it's not just the DeLuna properties, but other sensitive things. It's actually dealing with archaeological history, not monument necessarily, but if we had archaeological history that allows us to work and preserve those areas that actually have some kind of more archaeological historical nature for what they have. So I mean, I guess that's more the purpose of what we're looking at with that ordinance.
And this is from Jeremy. How long will it take logistically and cost to remove the monument?
I believe in the report, you've seen it, Jeremy. It's in the report. The numbers are there. If it is coming down, that's what we vote. We have funding options for the board to make those decisions. It really is dependent upon the decisions they make. But I will say this much: if that's the direction they go, we will be respectful in whatever we do and however we move. And again, from our standpoint, it'll be done by professionals who do this kind of stuff if that's where they want to go. If they don't want to go, they want to go somewhere else. See what happens. From there, we'll try to figure out what is the right way to display it, and again, trying to figure that out. So again, those will be all part of the discussions that I think we have after that. I mean, we've had any number of things. I mean, I've been shocked at how many people have asked us to place it in the Gulf as a reef. Obviously we have the cemetery, we have museums, but I will say we've had a lot of creativity come to us from citizens. So we certainly will look at all things, but I mean, I think we're going to handle it respectfully where it needs to go and those kind of things. But again, we appreciate all the comments that we've gotten, and we've certainly gotten a lot of them.
This is from Jeremy as well. You said there was an uptick in COVID cases among city staff in relation to community center closures. Do you have numbers?
Oddly enough, we have 4 community centers, and we had like 4 positive employees. I see Keith sitting there, and I don't know if there was one more, I think, that got there. So maybe we had 5 employees that have tested positive, but we had one at all 4 of the community centers, and we just felt like at this point it wasn't worth continuing the program at the risk of what may be happening with kids that come. We checked them as much as we could, and certainly we went through questions. We had somebody taking their temperature. We were dealing with things as pragmatically as we could. But at the end of the day, once we found out that we had the COVID cases that we had, and we had one in each center, it was like, hey. I mean, at one time we might have thought of going from one center to the other center, but if at the end of the day we had at least one case, in every one. But I believe the total I heard after this weekend was 5. So again, that was a number that we had from our employees. And again, we want to be sure that we weren't spreading or doing anything else to our children. It's a summer program. We certainly think there's value there, but at the end of the day, we didn't think the value of continuing was worth the challenge of potentially contaminating, getting other people sick if the kids go home and get somebody sick at their house. So, again, these are things we thought about, and we made the decision we did.
This is from Jeremy as well. Did the city legal department take a look at Mike Hill's assertion that the city wasn't allowed to remove the monument?
The city legal department looked at everything that was there, both state and federal, any federal legislation, and did not feel that any of those applied to the park. I think Susan did a great job of evaluating everything and looked at it and presented legal interpretation.
This is from Andrew McKay. It looks like you are asking Escambia to adopt a more robust mask ordinance for all public places than the city currently has in place just for businesses. Are you planning to ask council for a more restrictive mask ordinance for the city?
Let me be very clear, Andrew. That's not me. The council's asking for that. That's coming from a council member that has asked for that resolution. Again, we are continuing to do here. We do think that it would be more productive if we had a mask ordinance that was not just countywide, but really region-wide, which would be Escambia and Santa Rosa. The 3 hospitals have told us that would be the most effective thing that we could do for dealing with COVID, that we could deal with public policy. I mean, all 3 hospitals clearly have said that. The physicians have said that. The nurses have said that there. So again, we got into this for the whole purpose of dealing with making sure our medical community didn't get overrun. We're going to take their advice and we're going to go from there. So we've presented that. At this particular time, what the council wants to do and council members, they have that. If they provide that resolution, it will go to the county. I mean, the county will ultimately make the decisions they make. But at this particular time, we've got the ordinance we've got, and we're continuing to move that forward. We've got our policies and procedures, and we are using those policies and procedures to do what we need to do for the city. And again, we would hope that some way it's not just Escambia County, but the entire region needs to be using that together. If we do that, we can actually begin to make a dent in some of the numbers that we have.
This is from Rebecca with Channel 3. One of the county commissioners is speaking out about the city of Pensacola mandating masks. He believes there are too many exceptions to the mandate and questions whether the city should have even enforced the mandate in the first place. Do you believe this mandate is helping stop the spread of COVID-19 in the city?
Well, I think we're starting to see some things happen. If you looked at the numbers we talked about, we're already beginning to see a drop. Things are coming down. So I think that's showing what we're already beginning to see. Typically, for us to take a public policy in place, it takes about 2 weeks to see what happens with COVID. The fact that you saw over the last week positivity rates beginning to trend downward, we think is a positive impact. That's exactly 2 weeks from when we did that. So from that standpoint, we expect to see hopefully a flattening and a reduction. I think if that's happening, then it's showing that it's working. What we've seen dramatically, the first weekend we did it, I think I went out and I didn't see a whole lot of people necessarily wearing masks. By the second weekend, it was like everybody was wearing masks, and I couldn't go anywhere and I didn't see it. So I do expect those numbers to bear out for us. But again, these numbers are all region wide. So if the city of Pensacola is doing it, I think we can make a dent. But we're not going to begin to take the real measures until we all jump in together. And if we can do that, I think we can make real progress. But it's got to be a team effort. From that standpoint, we're going to continue to work with the county however we can, with our other sister jurisdictions, and also Santa Rosa County. If we can begin to make dents and improvements, we'll eventually get to a better place. If we can bring the numbers down, we'll be right back to where we were in May. And we showed in May we can have business open, we have things open, we can be doing things responsibly, and we can be keeping COVID rates low. So, as the governor said, May showed we can do these things. We just got out of practice, and it's unfortunate that we're not coming back to the three mainstays. We've got to do that. Wearing your mask, washing your hands, and socially distance. If we do those three things, we can turn this thing around for us.
This is from Jeremy with In Weekly. Any contact tracing being done in relation to community centers?
Certainly we report that in, and we've sent that. We report those things in. I don't know where DOH is and how much they're doing at this particular time. I do know. I've talked with cases. I know today at 2:00 I'll talk with all the hospitals and Dr. Lands again. I'll be happy to reach out to him a little bit about contact tracing. But again, that's not at this point. That's something at the DOH level that they're doing. I know they've done it some. I don't know if they're doing it everywhere. Again, I think probably once we've gone. I followed this thing religiously, and I remember it was about mid-June when we hit 1,000 cases. Today, I just told you we hit 4,000 cases. Now, again, I think that was mid-June was 1,000 cases of actual our residents, not including the ones from outside. So, and I don't know, I didn't get with the exclusion of the visitors and people from outside the area who are getting tested, but we're still over 3,000. And so we went 3 months with only going to 1,000, and we've gone in 1 month, we've basically gone 2,000. So something has certainly changed, and we're seeing things happen in what we've done. I think it's more a case of us not doing the things that we could have been doing. Mask is part of that. So it's unfortunate that, if there wasn't an election going on, I don't think we would have any problems with masks. It's just unfortunate that's what, I think that has more to do with it than what, I think the science clearly shows we should be wearing masks, and it's unfortunate that for some reason we've got to make this a debatable situation. But, it is what it is, and we're going to keep working through it.
This is from Jim at the News Journal. On the city's mask ordinance, what has compliance been like, and have any fines been issued?
I think we've seen a number of places that we've gone to. We've gone to businesses and we've talked with them. The one that is so interesting to me is the employees that end up calling me and saying thank you for making sure we've got masks. They're usually the ones they're so appreciative of it. We've gone to almost every business we've gone to. They've worked with us one way or another to figure out how to institute mask. I haven't gotten repeat complaints on anybody that we haven't visited. So we're still out there. We get complaints from the public that goes. We send Steve Richards out with code enforcement. We're working very well on education and what needs to be done. And generally, we've seen compliance at this point. I'm not saying it's 100% compliance, but I still see more people doing it than not. And from that standpoint, we're going to keep working. And if we need to continue to talk to some people, the biggest thing that I see is, it's like, oh shoot, I forgot. It's like I'm quickly running in the Tom Thumb, and I forget that I have my mask in the car, and I just run in. There are clearly times we've probably all done something like that. So, from that standpoint, we're working with things as best we can. But, for the most part, we're really going to businesses to making sure that they're doing it. And for the most part, what we've seen is certainly a lot of compliance with it. So, we'll see what happens. I get a ton of complaints from people that call me about different places that are outside of the city limits, and I remind them that our ordinance only includes the city limits. However, if businesses probably want to have their own policy, they're certainly welcome to have their own policy. It is their private property. If you want to shop there, you probably do need to follow what they're creating. So again, from that standpoint, again, I'd ask people just to follow those rules. If you go to somebody's house, you would follow the rules what they do in their house. When they come to your house, you can make the rules. So those are the things that are there. I try to, wherever I go, I try to abide by what I think I'm doing best for the community. Again, I don't know that I have COVID. I've been tested a lot, but I never know. So I need to wear a mask. The same thing with all of us. We can't tell who has the virus and who doesn't have the virus. So please wear a mask.
And this is from Andrew, following up on his question from earlier. He asked, do you want a more robust mask ordinance in the city?
I haven't asked for anything to change with the city's ordinance. I haven't asked council to do anything else or done anything one way or the other. And I'm perfectly happy with the ordinance we have at this particular time and working it toward compliance. What I would like to see happen is obviously the entire region go to a mask ordinance. That's what the 3 area hospitals are telling us needs to happen. If we really went the Escambia Santa Rosa area and we worked together and created masks, we'd start making a positive dent in these numbers and seeing what we could do. I mean, let me say the challenge is this, and I think if you remember, it was almost impossible in the month of March and April. It was very difficult to find somebody who had been touched by COVID. It was hard to find people. It was usually people who might have had a relative that was outside of the area, but it's very, very hard to find people here. I mean, we certainly had that opportunity to experience that fairly early with my son's case. But now it's almost where it's like you can't find somebody that hasn't had a friend, neighbor, something that has had COVID. We've had enough cases in the Escarosa area where almost everyone has seen somebody they know get the virus. Now, again, that's not saying that all of them have ended up having to go to the hospital, but some of them have. And I think if you know people who have been hospitalized, it's amazing. I was with someone this past weekend. Like I said, my wife's college roommate, and they were down from Huntsville, and they didn't go anywhere. We had to pick stuff up and take it in to eat with them in their unit at the beach because her husband's brother had COVID and was in the hospital. So again, I think if you know people who've had a severe case of it, it changes the way you deal with it. And I think part of the challenge is I think not all of us have seen a severe impact. I certainly didn't see that with my son, but I have seen people here within the city of Pensacola who have had impacts. And I think it's certainly whatever we can do to lessen those opportunities, I think is the best thing. It's one of those things where the vast majority of us probably, if we get COVID, don't even know it. We reported 4,000 cases. The Surgeon General for the state of Florida, the governors here, has very much said 10 people probably for every one that we have diagnosed. So you've got another 10 people out there who don't even know they have it, have sniffles, something else, wouldn't have ever gotten tested, have it. We've seen that with people I know who've been tested, who were tested either as a part of a whole system of where they worked or something else, had to get tested. All of a sudden they found out that they had nothing. They didn't know it one way or the other, and the test came back positive. So, I think from our standpoint, we've got to find ways to protect ourselves from those individuals that have very few impacts. Most of the people aren't going to get a serious case, but clearly some are. And the whole goal of this was to keep the hospitals from getting overrun. Now with 175, I was very encouraged the other day. We went down 5. I was very happy about that. We went up 5 the next day, and then we've gone up about 30 on Sunday. We should have the numbers from Monday fairly soon here. But again, we will continue to put those in. But as you see, our numbers go up and down, so they're not cumulative. The things we're tracking come straight from the hospitals every single day. We're putting that information out, and we hope you follow it on our website and on our dashboard, and we'll continue to have it there for you to follow. But it's our goal. We want to see that number start coming down. And if we can do that, that's a good thing.
This is from Jeremy. What about individuals? No fines/tickets for masks?
Well, I mean, there's certainly there's the ability for this to be fined individuals. But we're working very hard to educate. And for the most part, we haven't found anybody that when we've told and we've educated them that hasn't been working with us to put on masks. Again, so we just continue to work with it, and we'll see what we can do. I mean, we hope people will follow those instructions and figure out ways, to protect all of us. Again, you're not protecting yourself by wearing a mask, you're protecting everybody else around you. So at this particular time, that's what we're going to continue to keep working with, is to educate individuals and let them know that that the importance of this is it's not them. And so many the people I run into, they're like, hey, I'm not worried about it. It's about me. I'm not worried about it. I said, it's not about you. It's about the fact that you might give it to other people. If you are not worried about yourself, go do all the things, go places, go stuff, go interact with people, whatever. We're not asking you to, it's not about you that we're asking you to do it. We're asking you to wear it to make sure that you're not spreading it to other people. And once we generally tell people that stuff and they think about it, they put on a mask. It's common courtesy. I find most of the people that don't want to wear masks tend to think of it is it's supposed to protect them. And I keep saying it doesn't protect you. It protects everybody else.
This is from John with Studio 850. What's the latest with the boat manufacturing proposal for the port?
I believe that's going to come forward in August, and so we'll see that. I know legal's been working diligently with that, and to compile everything they learned from the individuals who went down to Miami to view the operations. So I think, as we talked about before, we generally had a very positive response by all those that went. We sent some city staff. We sent Jared Moore, and from our standpoint, we also had a citizen go that was Bobby Switzer. Bobby has both commercial property in downtown, and he's soon to have his home right there on Seville Square. So we knew he would be interested in making sure that there was no smell, no other things, and he went down there. We also had Florida West sent some people down there and other individuals as well. So the general information we got from the team is that they felt like we could structure a lease to make sure that financially the commitment is there from the lessor. They also made sure that nothing from the operations of the boat manufacturing was going to adversely impact the rest of the community. And if it did, we'd have tight provisions in the lease that would allow the city to get control of it and remove them if necessary. So, but they felt like for the most part in the operations, it seemed like it was, fairly good. But we're continuing to always look at things. If there's a way we can make things better, we're going to make it better. So we're constantly open and constantly looking at new things out there. So. We'll see what happens.
This is from Jeremy. Any development in regards to the lawsuit concerning the Tamar Crawford death?
At this time, I certainly can't discuss anything with lawsuits and legalities. So those will be handled by our legal staff. And when we have, if we ever have resolution, we'll let you know.
All right, I'm not seeing any new questions right now, so I think we can wrap it up.
Thank you very much. We, like I said, I'll be talking to the hospitals on this afternoon, and we will do another update on Wednesday. We have the Tuesday meeting and we have Thursday meetings, so we got a lot of things going on with the city this week.